I'm Dr. Kenny Levine. Welcome back to Health Talk on Uverse Channel 19, streaming live on the web at weyw19.com. I'm here with Dr. Matt Soff, gastroenterologist to the stars, including me. Matt, talk a little bit about heartburn, because I know that's a big issue today.
Most of us will have some degree of reflux after a meal. What's reflux? We eat, food goes into our stomach makes acid, the acid mixes with the food. As the stomach is sending the food downstream, some of it backs up into the esophagus. Most of the time that's asymptomatic. Most of the time the people aren't aware of it. That's called physiologic reflux. It's normal, it's part of day-to-day life. Every once in a while, someone will feel some degree of discomfort as the acid refluxes into the esophagus. That also is considered okay. Some other people will have that reflux frequently enough, severely enough, so that we call those people ill. We give them the label of gastroesophageal reflux disease.
GERD.
GERD.
Okay.
Now, most people with GERD who have gastroesophageal reflux disease, acid coming from the stomach, burning the esophagus, causing typical heartburn, easily treated with over-the-counter products like Zantac or Tagamet or omeprazole or Tums or Rolaids. Any of those products work very well. If a person has symptoms frequently enough and severely enough, that's when they come to their primary care physician usually. And for most patients, they're given a prescription strength of a medicine to suppress acid. And again, 80–90% of people will be fine. But now we're dealing with a small group of people that have burning, discomfort, indigestion that doesn't seem to respond to the usual acid suppression. And that's when they come to the gastroenterologist. For routine heartburn, pretty much any well-qualified internist is going to be able to handle that. So when we see someone with refractory GERD, that's the type of GERD that doesn't respond to the normal doses of acid suppression, we now have to look a little bit further. And there's a new test that we've been doing for the last several months, last several years, where we are able to monitor the acid that comes up into the esophagus during the course of the day.
We spoke about this. Is the test that was developed in Israel?
This is a test that was developed in Israel. It's marketed by Given. And this is a little chip. It's a little plastic cylinder that is placed and attached to the inside of the esophagus through one of the endoscopes that we use. This little chip is able to monitor acid coming up into the esophagus for a 48-hour period. Once the chip is finished, then it just passes out into the stool.
What do you do with the patient whose symptoms are not related to acid?
Great question. There's some very important things. First of all, one of the things we're going to be looking for is a motility problem. So that the esophagus, most of us learned that in high school, the esophagus has a nice, smooth peristaltic wave. Right. Nice and smooth. However, some people have spasm in the esophagus, what we call a nutcracker esophagus, because the pressure generated in a spastic esophagus is enough to crack a nut. So it's called a nutcracker esophagus. So in those kind of situations, we would need to give other medicines to relax the muscles. The nutcracker esophagus or esophageal spasm, those diagnoses are made through esophageal motility studies. Those are studies where we actually measure the contractions and the pressure generated by the esophageal muscle.
Now, I happen to know, because I've come across it, there's something called Barrett's esophagitis, right?
Barrett's esophagus.
Esophagus, thank you. And that's because of reflux that can turn into a carcinoma, cancer?
What happens is exactly right. We know that Barrett's esophagus is a pre-malignant condition. So what happens is there are different cells within the GI tract, and the cells of the esophagus are squamous cells or flat cells. The cells in the stomach are like columns. We call them columnar cells. If the esophagus with its flat cells are exposed to acid long enough, some patients have a change in their cells. That change, which is called metaplasia, a change of one cell into another, is called metaplasia. That metaplastic change can lead to cancer.
Okay. You know what? We're going to leave the endoscopy for a minute. We're going to come to the colonoscopy in just a moment. We
Okay.
haven't talked about that. I'm Dr. Kenny Levine with Health Talk. We'll be back in just a couple of minutes. Thank you.